Good evening, all of you. It's showtime again, but at 9 p.m. Our regular time, isn't it, for our interaction? Today, I'm going to track journey of a nurse practitioner. And when I say nurse practitioner, she has got an array of degrees like MSN, MHA, ARPN, and FNP-C. So she is certified nurse practitioner, and her name is Lourdes. So let me call her on my platform to understand what it takes to become a nurse practitioner in USA, because I was very curious when I heard about her journey, and as well I am curious to understand what it is like to become a nurse practitioner. It is a very valued profession. It is much required profession, and along with the physicians, the person who comes in daily contact or 24/7 contact with the patient are the nurses, because physicians come and go. And I have always heard this particular thing from very good physicians, that nurses are our eyes and ears, because we are not in patient contacts full time. But and I have seen many physicians, they take advice, or rather they have a conference call with the nurse to understand what it is like right now going on into say OT, or into say ICU scenario, what exactly is going on. So I've seen many, and I have seen physicians having a great respect for this particular profession, because they are, as I said, the eyes and the ears. So without further delay, let me welcome Lourdes to my platform. Hello and namaste.
Hi, thank you so much, Manisha, for having me here.
Yeah, so it's very good to have you today here, and we are blessed that you agreed to come on this particular platform. And yes, so tell me something about yourself.
So I am Lourdes. I am a first-generation college student, and my parents worked as assemblers and janitors when I was growing up.
Mm-hmm.
I was born in the Philippines. I came here when I was about 6 years old and became a U.S. citizen thereafter. I am now a mother of two, and I work full-time as a family nurse practitioner. I've been doing this for about 4 years now.
Great, great, very, very nice. And so, Lourdes, at what point of time in your life you decided that you want to do something in medical field? Because there is a calling, or there is some ringing bells in our ears that okay, I want to go there. Sometimes it's pre-decided, sometimes it's not decided per se, but we are pretty much clear that we want to take this particular type of a profession. So what about you?
I actually did want to go into medicine, or at least in the medical field, somewhere in healthcare when I was young. I thought I'd be a pediatrician when I was younger, because I enjoyed my own pediatrician. And
Hmm.
then growing up in a Filipino household or around Filipinos, of course, there's a lot of Filipinos who are registered nurses, and you hear a whole lot about that. Um,
Mm-hmm.
I did not have any in my family. But
Okay.
around, cousins and things like that, outside of my immediate family, I've heard nurses and going to nursing field, things like that. But I knew at a young age I really wanted to go into healthcare because of the inspiration from my pediatrician. It was
Mm-hmm.
just where in the medical field or where in the healthcare field I was going to end up.
Yeah.
Yeah.
So it was great. I think it must have been a great experience for you to do this. And now, Lourdes has got a non-traditional route.
Mhm.
A traditional route for nursing in USA would be, first you do your LPN. If after your 12th standard you have fixed that you're pretty sure that you want to go for nursing, two, three paths people take. First they do their LPN, then they go for their ADN, and then they can go for their BSN. Some people after 12th standard directly do their BSN, which is a 4-year course, and after then they go for their masters. Instead of that, what Lourdes did, let me ask her.
My journey was not a straight shot from point A to B. It
Mhm.
was a long journey. It took a lot longer than expected. Like I said, I am a first generation college student. I did not grow up in a good, like a well-off, financially well-off family. So I had to work throughout the time I was in school. And I had to really decide whether or not I'd go into medicine per se, if I wanted to go into becoming a pediatrician or a doctor. I had to really decide, was this really the field for me? It's going to take some time. It's going to take a lot of financial responsibility. But I basically, like I said, it was a long journey. So I did my years of high school. I went into pre-med in college because I knew I wanted to go into the healthcare field. I graduated with my bachelor's in science and biology in a 4-year college. And then I had to decide, was this really the field for me? And do I really want to take on this career? Again, I was really worried about the length of time I was going to be in, and was I able to support my family thereafter? So I had to really make the decision of, is this really the field? And instead of going into medicine or into the medical field and applying and taking my tests and everything else, I wanted to see what it was like. So I worked first, and I worked in the healthcare field. I initially worked with an OBGYN at her private practice. I worked as a front office person. I also did billing. So I got to see the administrative side of healthcare, which I also really enjoy. But I worked there. I got to see what she did. And then that's where I got to see what a nurse practitioner did. This was my first interaction ever with a nurse practitioner. I knew what nursing was. I knew what being a doctor was. I just wasn't sure if there was anything in between. And that in between was basically something that I would fall into. It was a career where it didn't require a whole lot of years of study. I mean, being in the healthcare field, studying never stops. You being a student, you learning, you
have to be a continuous learner.
Exactly.
And if I may interrupt you, you finished your pre-med in year 2000, right?
Correct, I did.
Yeah. And then after that, your journey started. You worked with OBGYN person
yes. So actually, my pre-med career actually started in 2000, ended in 2005. I worked with an OBGYN office for some time thereafter. And then I also worked in, what is this called? A Genentech. It's a pretty big pharmaceutical company. And I got to do a lot more patient interaction with them as well.
Okay.
But for the most part, I worked in healthcare, either on the administrative aspect of medicine, of healthcare, and working with patients directly with their medications and getting enrolled in programs that are for patients who are underserved. So that's, but it was at the OBGYN office that I learned a lot about the nurse practitioner career. And then I also learned about the administrative side of healthcare, and me being the person that I am, wanting to learn medicine as a whole, I looked into getting my master's in health administration the time I was working at the OBGYN office.
So, Lourdes, this is your first master's. Master's in health administration.
That would be my first
After your
master's.
BS, you have done your first master's while you were working in the office, right?
Correct.
Okay, proceed. Yeah. So we have done the master's along with your okay. Great.
So after learning about what it was like to be a nurse practitioner, at that time I've already been out of school for so long that I needed to redo my prerequisites to get into nursing school. And it wasn't a straight shot trying to get those prerequisites either, because working full-time, going to school full-time, and then trying to get the classes that you need was a little bit difficult. So it took some time there because I had to take some time off because the classes weren't available to me, etc. Right?
Yeah. So the prerequisites you required were, I think, anatomy, physiology, something like that, because
Yes.
Okay. And
Lourdes,
what was happening at your personal front? Were you married at this particular point of time?
I was not married until 2011.
Okay, great. So we will proceed. We will proceed till you are married. We'll proceed. Yeah.
Yeah. So but the whole time I was working is basically what I was doing until I got into nursing school.
Okay, Lourdes, please continue. Sorry for the interruption.
That's
That
okay.
what happened next? You were taking your prerequisites. After
Mhm.
that, what you did?
I applied to nursing school while I
Mm-hmm.
was finishing up on my prerequisites. I fortunately got accepted into Samuel Merritt University. I looked into different programs, but I knew for sure I need, because of my age and because where I was at in my career, I wanted something that was accelerated or quick. How soon can I get my master's degree? I know I had a healthcare background already. I worked in healthcare. I've seen what doctors, nurses have done. Um, so I wanted something quick as a
Yeah.
school. Like I said, I'm still constantly learning. It's not that I stopped learning after school, but I wanted a
Mm,
degree where I can get it quickly since
mm,
I've been in school for such a long period of time already. So Samuel Merritt had an accelerated master's in science of nursing, where you can get your MSN degree, but
hmm.
you work to get your RN license, and then you work to get your nurse practitioner license, all within that 3.5 year program.
Okay, okay. So everything could happen simultaneously for you because it was an accelerated program, and
Exactly.
you were accepted into an accelerated program because you already had a healthcare professional experience. Is
Correct.
that so? Okay, okay, okay. Yes, please proceed. Then what happened? Was it, how tedious was it for you to take your master's degree, MSN?
Since it was an accelerated program, everything happened so quickly. You had no time to work. At least they advised you not to work because it was so quick. Um,
Hmm.
the first 15 months of the program was you studying to become registered nurse, take your RN license thereafter. And in order for you to move on to the next part of the program, which is the nurse practitioner, and do
Hmm.
clinicals with that, you had to
Yeah.
have your RN license. And
Hmm.
so there was no time to work. It was always constant studying, constant
Okay.
learning, and then clinicals all throughout.
So I think after almost your 10th standard or 12th standard, what you were
Mhm.
doing is you were earning, learning, and
Yes.
only learning, but you never left learning.
Correct. Correct. That's a great way to put it. Yes.
Yeah. So I think when you get a certificate for continuous learning, you must be the topmost. You had
I
never left
I
learning.
have yes.
Great, 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 great. Okay. So in which year did you get your license?
I graduated and got my license in 2017. That's my
20
master's, yes. And I got,
masters, yes.
correct, yes,
Hmm, 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 hmm.
2017.
2017 you got it, and before that in 2011 you got married, and during the same time period your first daughter was born.
Yes, I was in the nursing program.
Mm-hmm.
I finished my 15-month, the first 15-month half. I took my RN license. After
Mm-hmm.
my RN license, we found out we were pregnant. So that was around 2015. And I had my first daughter in nursing school.
Okay. So as well as practicing on another patient, your OBGYN has been practiced on yourself when you were doing your
Exactly.
nursing.
Yeah, and the other
Okay.
students as well. They got to experience all of that.
Yeah.
Yeah.
True, 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 true. So you gave a good practice to your friends too, maybe.
Yeah.
Uh, okay. So now this is year 2018, roughly, or 17 when you got your
Mhm.
license, and then after that, what happened? And were you full time employed after that, or how you were balancing your work life? How you were looking after your family, and are you working part time or full time, or how does it go?
I was fortunate enough before I graduated my program. Um, Dr. Silver, who I work currently now, he was a physician working with Team Health, who's the company we work with that contracts
Mm-hmm.
out to our organization that we currently work with, or our facility. He was looking for a new grad student,
Mm-hmm.
specifically a new grad. And during a career fair, I got to meet the recruiter who he has worked with and has requested for the new
Mm-hmm.
grad to work with him. So I got to I got to meet the recruiter. And before I
Mm-hmm.
took on any offer, I requested to shadow a nurse practitioner in that type of, in the field that I am now in, and also shadow Dr. Silver, because I wanted to see what the job entailed.
Mm-hmm.
I currently work in a skilled nursing facility, and I work with geriatric patients, and our biggest patient population also is psychiatric. I am not a psychiatric nurse practitioner. You can go into that specialty for further education. I work
Mm-hmm.
as far as dealing with patients with depression, but anybody beyond that, like schizophrenia, bipolar, we work with the psychiatrist. And we
Mm-hmm.
also work with Dr. Silver, who is at the facility. But I have immediately after getting my certificate, I was able to work. And again, I was working under Dr. Silver, and I've been working full time
Mm-hmm.
for about 4 years now. Started in August of
Okay.
2017. And our work
Mm-hmm.
is a little bit different because the field that I've gone into, or at least the current field I'm in, um, it's a skilled nursing facility. So Dr. Silver is the main doctor. I'm the secondary to him. So we kind of work 24/7 in a sense,
Mm-hmm.
on call. It's just the two of
Mm-hmm.
us. So physically we're there, but when we're not there, we're answering calls, answering faxes, on call 24/7. So I like what I do. It's a hard balance being a full-time practitioner, and then working full-time, and then being a mom full-time to two kids
Yeah.
who are younger. Um,
Hmm.
but there is a lot of flexibility in the job that I do as far as the scheduling or timing that I'm at. So I'm
Mm-hmm.
fortunate in that sense, but it takes a village. It takes a
Yeah.
village to
True.
care for, to be where I'm at right now. So I'm fortunate enough to have my husband who helps support me throughout my whole journey. My mom who's helped take care of the kids. So it's a big work life balance, I gotta say.
Yeah,
But we
without
manage.
family support, you cannot do what you are doing, because it's
Mhm.
very important. Because the people who have worked with, or I have interviewed, all of them say the
Mhm.
same thing, that in case of a medical career, family support is very important.
Yes,
Because a medical practitioner or whomsoever works in the medical field, they have to keep their cool when they are working. You
correct.
just cannot lose your balance at your workplace. Maybe someone else can, but you people cannot. And therefore, to keep that cool, your family life has to be sorted and settled. Then only you can keep your cool at your workplace. Because if you are disturbed at your home front, then maybe it reflects at your workplace. And I think medical professionals cannot afford to do that, because it's very hard then, and harsh on their health and their mental state also.
Correct.
So I think you are doing a fabulous job out there. But how does Lourdes react under pressure?
It's a challenge. It's a challenge. But because healthcare is not just you as an individual. You work as a team,
Hmm.
and the team that you have, just like you have a village at home, you have a village at work, to
Mm-hmm.
help manage the people, and to help manage the patients that you have. Right. So, and this is why I went into healthcare, because it's not just about me. It's about the team, and it's about
Yeah.
the patient, right? So when it comes to dealing with or reacting under pressure, um, I it's a challenge, but you work and prepare for that. Um,
Yeah.
as a nurse practitioner and working with Dr. Silver, working with the nursing staff, we work together in all of this.
Hmm.
But as
Mm-hmm.
an individual, you come prepared.
Hmm.
You educate yourself on the things that could possibly happen that day, or what can happen any day and any time of day. But it's about just being prepared and educating yourself on anything and everything that you can.
Everything can happen, yes.
Exactly.
There is no
Anything can
set
happen.
things, because you just cannot
Correct.
plan in advance or set up
Correct.
things in advance that this is what is going to happen. Anything can happen at the facility. So
Correct.
yes, you have to be prepared. Any incidents which you remember when you were studying your nursing, or you were doing, which said, oh wow, this is one of the parts of my studying or my practice, or in future this is what I am going to face. Anything you remember? Which
Um,
just puts smile on your face either, or you feel very sad or depressed about it. Both the ways.
so when I was in clinicals, I think this one is a more just the hard reality of healthcare. You think about what you can do with a patient and to help them out, to help them get better. But on on this incident is when I had to during my internship, I had to work with a patient who was in hospice and dying.
Yeah.
And you don't think a whole lot about that when you're thinking about wanting to help patients get better, right? Or at least for me, I've always thought about the good in healthcare, and you do good also with hospice, right? And caring for somebody,
Yeah. Yes.
but
Yes.
that was
Yes.
a big shock to me. And seeing the dying process of 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 health of somebody's health, and it opened my eyes, and it basically um, made me stronger, and just helped me understand that healthcare is not just about the start and the life. It's a lifespan, but you also have to look beyond life, and you see what's the end of life, basically. um,
Did you people turn to spirituality when something like that happens?
I'm religious, so I do. I do personally. I don't put it on my patients, but inside, and yeah, just as personal, when I'm
Yeah.
there and
True.
they're not. But I don't put it on my patients. I
No,
don't
no,
put my
that's not
yes.
correct. But yes, to keep yourself grounded and
Correct.
be emotionally strong, maybe you have to have some faith in something out there.
Yes,
Otherwise,
I agree. I
it
agree.
becomes very difficult.
I
Yeah.
agree. If you
I-
don't have that faith, at least have the support of somebody, and somebody to talk to, because burnout is hard.
Yeah, bro.
Stress
In this
is hard.
profession, burnout is tremendous, and emotional
Exactly.
burnout as well as physical burnout. It's not
Exactly.
only either or; it's both
Exactly.
simultaneously.
Exactly. Exactly.
Okay, okay. So, who is your right now, or in previous days when you were studying, who was your role model or your motivator?
Um, Consistently, my motivators have been first my parents. I grew, like I said,
Mm-hmm.
I've seen their hard work. They've taught me hard work and hard values to begin with.
Mm-hmm.
My husband, he's been
Mm-hmm.
very consistent with me.
Mm-hmm.
Um, been there through the ups and the downs, and there's been a
Mm-hmm.
lot of crying through nursing school, through even
Yeah,
now with the challenge of
I'm
having
sure. I'm
two
sure.
kids. And then my children have motivated me. They've, I'm the role model now. I'm the
Mm-hmm.
person that will set good examples for them. So they've been my inspiration and my motivation to keep moving forward if times get tough. And as far as my current career goes, I really look up to everybody around me. Dr. Silver,
Mm-hmm.
who guided me, the nursing staff. I am a nurse practitioner, but I've learned from my CNAs. I've learned
Mm-hmm.
from my administrators. I've learned from everybody in healthcare. It takes a village and a team, and it's not just me, right? So it's nursing, it's the housekeepers, it's the kitchen staff, it's the administrators, everybody. We all learn from each other, and each and every day, I'm just, I'm amazed at
Yeah.
how well we
I'm sure you are
work
a very
together.
good observer because you have been a continuous learner all your life. So
Mhm.
I'm sure that you must be learning a lot from everyone around you.
Yes.
So yes, for example, a typical day in your life when
Mhm.
when you're working, the day when you're working, what's a typical day like? And are you able to disconnect from your home when you move into your working scenario?
That's a fantastic question, Mandusha. So my again, I'm a little bit different when compared to, let's say, working at a hospital setting or an outpatient clinic setting. In my position, there's a lot of flexibility. So I work Tuesdays in the office, Tuesdays, Thursdays,
Hmm.
Tuesdays, Wednesdays, Thursdays, Fridays.
Hmm.
Um, but I am on call, just like Dr. Silver's on call. We're on call 24/7. So
Hmm.
there's
Hmm.
really not a set 9 to 5 hour that I have. I go into the office, I see the patients that I need to see, I write the orders, I dictate my notes, and I could be home earlier than usual or earlier than if I were to work at an office that's 8 to 5, 9 to 5, things like that. But
Hmm.
my days consist of looking at faxes to see, reviewing labs,
Hmm.
um, making medication refills, putting those in, getting calls from nurses about anything acute going on with our patients, and then learning. I try to do as CE classes that I'm able to squeeze in for 25 minutes, 30 minutes, an hour or so. Do that. Read read guidelines and journals, just to make sure I'm up to date. More guidelines than I do journals right now, but just learning if I'm not in the
Hmm.
office. And as far as disconnecting, I think in where I'm at currently with my profession and where I'm currently working, I can't disconnect from my phone. I'm constantly making sure that I'm not getting a message from the nursing staff. But I do try to, at a cutoff time, this is where I need to be at with my family. So I at least have
Hmm.
dinner with the family.
Yeah.
That's what we try to strive for. But it's that I wake up in the morning, check my faxes, review the faxes, review labs, put in any medical orders if I need to, or refill prescriptions. If I'm not in the office, that's what I'm basically doing most of the day. If I'm in the office, then obviously seeing the patients, taking care of anything that needs to be signed,
Hmm.
and then charts, lots and lots of
Good,
charts.
good. That's a huge day, and that's a big day for you.
Yeah,
Doing all
exactly,
this, yours, yes, yes, yes,
exactly.
yes. Great. So, what do you think, Lourdes, a person should have the skill sets, the traits to become a good NP?
I think I think to become a good NP or just a good provider overall, you have to have the empathy to be with the
Mm-hmm.
patient. I
True.
was always taught in nursing school you have to be flexible. You can't be
Hmm.
rigid. You have to be flexible. Everything changes.
Mm-hmm.
One moment, everything is fine. Next moment, things are very chaotic. Um, Flexibility is key. Being a team player, just in
Hmm.
healthcare in general, being a team player, you can't just focus on yourself. The healthcare
you
revolves.
you you have to be functioning in a unit. You just cannot
Correct.
function independently or individually, like me and my patient. There is nothing like that. You have to
Correct.
work as a team, so you must be a
Exactly.
team player, I think so.
Exactly. Exactly. And that's how you build, good relationships with everybody. If a patient needs a certain diet, talk with the dietary in the kitchen. If the patient needs, to be cleaned more often, the building rapport with other ancillary staff in
Mm-hmm.
healthcare. Um, and time management, I think, is key. I think that's
Key.
something that I'm still working on, and it's challenging
Mm-hmm.
for me, especially with having the family. But time
Mm-hmm.
management, as a nurse practitioner, we see, um, patients like to spend a lot more time talking with
Yeah.
nurse
No,
practitioners,
and
and I
the
think
facility in which you are working, at least these people don't have families, so they are more keen because someone is coming to them and talking. That's
correct.
more than enough for them. So they are overwhelmed sometimes, and they must be asking you to just keep sit and talk with me. So, uh,
Exactly, exactly.
yeah.
No, I definitely have to agree. The patient population that I work with. So, being patient with them, but time management is key. It really is. It's something like I said, I'm still working on with my own career. Um, but time management, flexibility, working as a team, having the empathy, um, Yeah,
Great.
those are key things that
Key
I
things. Yes, yes,
exactly.
yes, yes, yes. I perfectly agree. And the way you have taken the journey you have traveled, it's the
Mhm.
most important thing coming from a person like you. Because where do you see yourself 10 years down the line?
Well, that's a great question. I obviously still see myself where I'm at as a nurse practitioner. Um, I want to be able. At some point, I thought in my earlier time frame, I would open up my own practice, things like that. But I think where I'm at right now, I'm happy. 10 years from now, I would still probably want to work with the patient population that I'm with right now. The most vulnerable, don't have family, things like that. People who are underserved. Um, I, I I'd want to be doing preceptorship work, working with
Okay,
students, doing
great.
that.
Yeah.
Um, but definitely
As
still
a
where
lot
I'm at.
as being that you are a continuous learner, would you not want to do your doctorate
I'd
and
look.
teach in a nursing school?
I would love to.
You will be a very good teacher, I think.
I would love to. I think part of it, like I said, is time management, and with the kids being still young, maybe not right now. Maybe beyond 5 years. If I look
Oh.
beyond 5 years, because it is
Mhm.
going into the doctorate program. It's a
Mm.
short program as well, about 15 months or so. So it shouldn't take
Mhm.
so long. And being in the field, you'll have your clinicals, and you'll have
Mhm.
people that you've worked with already that can possibly help with placement, things like that. But yes, maybe not 5 years, maybe beyond 5 years, and
Hmm.
within 10
Yeah.
years likely, yes.
Yeah. So we can say that that is your goal and objective. Can we define your goal and objective that 10 years down the line maybe we could see and we could interview one more time you that now
Oh,
you have a doctorate degree under your belt.
that would be great. Yes, that would be great. But I definitely agree.
Let us see how it goes.
Yes, yes.
uh, uh, keep your fingers crossed. That's what we can say. Okay, Lourdes. So, last but not the least, any advice would you like to give your juniors? Any advice, a sincere advice,
Yeah.
not looking at the cost part or anything
Mhm.
else, but the passion part. What advice would you like to give them?
Don't give up. It took me
Oh,
years.
great.
It took me
Great.
years. It took me years to get from point A to point B, and it wasn't a straight shot. It was all over the
Mm-hmm.
place.
Mm-hmm.
But don't give up. It's hard.
Mm-hmm.
You're gonna cry. You're gonna want to
Mm-hmm.
break down. Uh,
Mm-hmm.
you're gonna want to give up. And things happen. Things happen in between, and
True, true.
you're gonna need that. You're still gonna need that passion. What is it that why did you go into this field to begin with? You're gonna need to remind yourself that, um,
Hmm.
even with the pandemic that just happened, right, or what's still happening now, it's hard.
True.
It really is hard.
Yeah.
But you have to
Mm-hmm.
keep yourself grounded and know that
Mm-hmm.
you did this for a reason.
Mm.
Um, you're going to make an impact in somebody's
Mm-hmm.
life. If it's not your patient, it could be your coworker. It could
Mm.
be you without you
Yeah.
knowing it. But don't
Yeah.
give up.
Mm-hmm.
It's going to be a long, tough journey. But as long as you have the passion there, and if you understand why you're doing this, and it's
You're quite convinced and you
correct.
have got the motivation and you have got the support, because this also sometimes
Hmm.
takes you back, because if you don't have a support system, then at one point of time when you just are reaching there, you give up,
Correct.
because you don't have a support system. So yes, you have to be grounded and have a good support system also,
Yeah.
maybe.
Yeah.
So anything else you would like to have, or share any incidents where you are working right now? So anything you wish to share with either Dr. Bruce or Dr. Rashmi, or whomsoever, whatever your experience was, or with any patient for that matter.
I love working where I'm at right now. I love the team that we have. Like I said, healthcare is a teamwork. effort.
Mhm.
It's not just one person. Going into a profession that's looked at highly, like being a
Mhm.
physician, um, being a provider for a patient,
Mhm.
um, you got to keep yourself grounded, and you have to
Yeah.
have that empathy with the patient. You have to have the empathy and the charismatic. Be charismatic with your patients and your
True.
staff, the patient
Mhm.
people you work with, because it really is about that. You cannot look at yourself and say, "This is my patient.
Hmm.
This is who I am." Right? You work as a team, and be just I can't say more anything like that. I really
I
appreciate
know.
I
I
really
know.
appreciate where I'm at right now with life, with who I work with. I've been fortunate enough to be taken under Dr. Silver's wings. And here in California, as nurse practitioners, we're not fully autonomous, meaning we're not able to work independently yet. We still
Mm.
have to work with under the supervision of a provider. And Dr. Silver has really taken me under his wing, and he has supported me throughout my journey. And I appreciate him for that. I appreciate Rashmi and the team for everything they've done, because the work they do is amazing.
True.
It's nonstop, and the amount of passion that you see in everybody that I've worked with is great. I've had really fortunate um, opportunities with other providers that I've worked with, other doctors that I've worked with during my preceptorship. And that's the other thing is, just if and when you get to being where you're at, being a doctor, being a nurse practitioner, being a physician assistant, being a nurse, where you're at right now, always look back at where you came from, and help those that are
Remember
currently.
your roots, I think that's what
Exactly.
you want to say.
Exactly. Remember
Mhm.
the roots you came from, and remember to help those that are trying to get into the field where you're at, because at some point they're going to be your coworkers, your colleagues, and you're going to make the impact in their lives, right? So
True,
me
true.
doing
Very
this
true.
interview, me doing this interview, I'm hoping that it can help others realize, healthcare is a long journey.
Mhm.
Whatever field you're going into, it's going to be hard and tough, but you're going to get there at some point, knowing that you have that passion there, right? Passion to do the things that you want to do in healthcare. Um, but I can't say much more
Yeah.
about.
No, no, it's perfectly
So
fine. You are such a nice person, and I know you are emotional and having a lot of empathy that shows in your words. So I just love the way you today talked. You today expressed yourself. You poured out your heart and your true feelings into this, and I'm sure
well,
that uh, whosoever watches this will be motivated as well. They will understand what it takes, the depth of the profession, because I
yeah.
know the basic thing about interviewing people is to understand the depth of the profession in which you are going to
Mhm.
enter. It's not anything superficial, simply like you go and you come back. It's nothing like that. It
Right.
takes a lot of depth, this particular profession. Okay, so thanks a lot
Thank you.
for sharing your experiences and your journey on my platform. So signing off from Breakthrough Higher
Thank
Education.
you.
Good night to India and good morning to US.
Thank you.
Thank you.
Bye.
Bye.